Hello, everyone, and welcome. My name is Katie Craig. I'm a white woman with brown hair. I have on a dark gray t-shirt, and I have a kind of a greenish orange background with the ARC logo on it. I am the West Central Quality Council Coordinator. I'm joined by my
I
coworker,
got to go for this.
Christine, who will share basic information about waivers with you. Courtney is the Regional Capacity Building Manager at the ARC Minnesota. She is a licensed social worker with experience as a waiver case manager and as an advocate at the ARC, helping people navigate county services like waivers. The screen right now shows a white background with the ARC Minnesota logo. And Courtney, did it switch?
There we go.
Oh, here we go. Sorry about that. Today's presentation is made possible through the West Central Regional Quality Council, funded by a grant from the Minnesota Department of Human Services. We have a regional quality council in the Metro, Southeast, and West Central. We also have one in the Arrowhead regions of Minnesota. These groups promote best practices, develop and implement quality improvement projects based on person-centered principles, and we make recommendations for statewide changes to improve the quality of services and supports. If you would like to get involved in a regional quality council, you can sign up for our newsletter, or you can email me at katiecraig@arcminnesota.org. And Courtney.
All right, thank you, Katie. Just a FYI for those folks here live, I did turn some microphones off in the settings here. So if you would like to talk later on in the meeting when we have questions, you are more than welcome to do so. If you have any trouble turning that back on, just put in the chat. We can help you out with that on our end. But for now, we'd like those microphones off to limit the background noise. So get into this slide. At the top, it says centering access. So I really want this presentation to be accessible to everyone. So please use this space as you are in the space you are in as you need or as you prefer. Communicate through your body, voice, other methods, chat, or turning off that microphone when we have a chance. You can close your eyes, you can doodle, write, fidget, have your supper, whatever you need to do to just be who you are, take care of yourself, and do what you need today. My name is Courtney. I am a white woman with brown hair. I'm wearing a purple and white shirt, and I am in my home office today, and I am going to be hydrating a lot today because my voice went out over the weekend. So that's what I'm doing to take care of myself today. So you may see me pause a lot for beverage breaks. Kitty, you can go to the next slide. So before we really dive into the meat, I wanted to go through a few definitions that may be mentioned in today's training. There may be others as well, and there will be a lot of information to process, especially if this is your first time exploring waivers. Don't worry about understanding everything right away. We will send out this slideshow after the training so you can have it for reference. But these are just a few simplified definitions of very complex programs. Each one of these could be its own training, but I wanted to level set a little bit so you had a frame of reference for some of these things that may be mentioned. So Medicaid, or medical assistance, is our Minnesota's Medicaid program, also known as MA. So those all three things mean the same thing. It's healthcare and disability specific services. So you could have medical assistance just income-based that you're using just for health insurance, or MA, disability-based MA, is what can pay for things like waivers. Home and community-based services waivers, the full name for waivers, but that is the disability-specific services through your county that we'll be talking about today. A Min Choices assessment is an assessment that determines whether you can get county services. The next one is a lot of acronyms, but they all kind of go together. It's Personal Care Assistant, or PCA, Consumer Support Grant, or CSG, and Community First Services and Supports, or CFSS. Now, these are things that people often are talking about in conjunction with a waiver. They are different, so they're still going through the county, but they're a different service. And so we will touch on them a little bit today, but we won't be diving too far into that. I just wanted to put a little note here that CFSS, or Community First Services and Supports, is supposed to be replacing PCA and CSG. So time will tell what this implementation looks like for individuals accessing the programs. But if you are wondering about any of those things, again, we may touch on them, but we're really going to focus on those waivers today. And then another, just more of a FYI, Waiver Reimagine is an initiative to improve waivers in Minnesota. And once this goes into effect, some of the information in this presentation won't be accurate anymore as those changes are made. That's tentatively 2026. So there has been some work done on that in the past years, but this will very much be just basic understanding for anybody who maybe has never heard of waivers, or you're just in the process, or maybe you have a waiver, but you're not sure, like all of these other inner workings. So I just wanted to level set that Waiver Reimagine is coming. Some of this will no longer be true once that happens, but is true and accurate right now. Next slide. So this slide is for those of you who like historical context. Before the creation of HCBS, or Home and Community-Based Services waivers, Medicaid, or medical assistance funds, were used for state institutions. Then federal legislation was created allowing Medicaid funds to be used for services outside of an institution. You may hear the term deinstitutionalization, which references this. It encourages states to develop supports that will help people participate in their community. HCBS services help people with disabilities remain in their community, participate as much as possible, and become as independent as they can. So that's just a little history. I know that it is not the full history, but it kind of gives you a little bit of context into waivers. On the next slide here, I have outlined the path to a waiver, and there's a lot of text on this slide, but I wanted, for those of you who want just like a screen grab of what do I do? What are the things? What's the path? This is for you. So the first thing to do is to contact your county or tribe to request a min choices assessment and apply for medical assistance. Now, even though these are two separate things, I have them listed both as number one, as they're related and can happen in either order. Often MA applications will happen first, but that's not necessarily a requirement. Some people are able to have a min choices assessment first. So for MA, the medical assistance portion, you would complete the application and certify your disability through Social Security or the state medical review team. Those are the two ways to certify your disability. And again, both of those could be their own presentation. But for the purposes of today, that's the way that you would certify that you have a disability and would require disability-based medical assistance. A min choices assessment is an assessment that's scheduled with your county or tribe, and we have the next slide will go into that in a little bit more. If the min choices assessment determines that you qualify for a waiver and you're approved for disability-based medical assistance, you'll work with your county or tribal representative to develop a support plan. You can be approved for services if they're allowed under your waiver and you have an assessed need for the service. So it has to be both of those. They have to be something that the specific waiver that you have will pay for, and you have been assessed to need that specific service. So we'll get into the different waiver types and what they can cover in a little while, but I want you to have those things in your mind where they have to be covered under your specific waiver, and you also need to have an assessed need. So many people wonder why someone they know can get a particular service while they can't. And this may be because they had an assessed need for that service and you either haven't been assessed for it or were assessed and did not qualify for it. If this situation happens to you, you can always ask your case manager if this is something that you could qualify for. But this tends to be a big one, as oh, I also have a DD waiver, or maybe you have a different type of waiver, and all those kind of nuances and specific situations can come up. So I like to have that caveat first. So now we're going to get into the Min Choices assessment. This is completed between you and a county or tribal representative. You can ask other people you want to participate in the assessment. So it doesn't have to be just you. You can have other people there if you want. And it isn't really supposed to be part of a formal meeting with the provider agency. Like if you have an annual meeting and you have many providers and they're all there, the Min Choices is supposed to be separate and be just focused on that assessment. The assessment identifies your strengths and needs, what is important to you, and what is important for you. So you really end up talking about those worst days of, what you really need support in, and it can be a really tough assessment, but it is required to get on a waiver. So I have a tip for everyone that when the assessment is complete, if you go through, you have a Min Choices assessment, request the full report, not just the summary. So most assessors will give you a summary that simplifies the results of the assessment. And honestly, this can be really helpful as it can be easier to understand than the full assessment. It can be very convoluted and you're trying to interpret what these things mean. So having that summary is really helpful. It gives you that snapshot in a little bit simpler language so you can understand it. However, only the full assessment will show you the answers to all of the questions. So there's many, many, many questions that they will ask you. And you can look at the answers to all of those if you request the full assessment. If you believe your assessment is inaccurate, like in particular, if you get back the results and it shows that you don't qualify for as much as you thought you would qualify for, then you can go through line by line each question, and maybe you'll find some errors where they wrote down the answer wrong. I mean, there's a level of human error that can happen with this, and then you can find those and tell your assessor, hey, this is inaccurate. Actually, my, child does need help going to the bathroom, or they need help with XYZ, whatever it is. And on the assessment, it says that they don't. And then you can have that edited. So there's my pro tip for everyone. Ask for the full assessment. Okay, I'll stop talking about that full assessment and get into the community support plan. So for this, you will work with your county or tribal rep to develop a community support plan based on your assessments. You've already had the Min Choices assessment. Now you're developing your plan. So it's gonna describe your needs and goals, describe how your needs, wants, and preferences will be met. Make sure supports in your plan are needed for your health, safety, and welfare. Make sure supports are not covered by any other funding source, and make sure the costs are reasonable and typical. And at the end of the day, the Department of Human Services makes the final approval. So there's all of these different factors, and that's why you will work with somebody from the county. It typically would be a social worker, case manager. When you're first getting on a waiver, there's many people involved, right? You have your assessor, and there will be other people at the county that you're talking to, and you might not have your ongoing team yet. Eventually, though, you'll have a case manager assigned to you, who typically is a licensed social worker, and they will help with all of these things to make sure that you're meeting these 5 or 6 however here on this slide requirements. So we will move on. It's a lot of information. We'll kind of digest and pause for some questions at the end. But I do want to move on to MA State Plan Services. So I'm including this slide because in order to qualify for a waiver, you must first prove that MA State Plan Services are not enough to meet your needs. After your Min Choices assessment, it may be very clear that you need a waiver right away to meet your needs. However, sometimes individuals may need to try these MA State Plan Services first and prove those are not enough to meet their needs before the county will approve a waiver. So the examples are listed on this slide, but a very common one is, just PCA or CSG. I mentioned that earlier in our definitions, and I think at least one person asked that question, if not several of you. Do I need to have CSG first before I can get a waiver? And the answer is sometimes the county will say CSG is going to meet your needs. You don't need a waiver. We're going to have you do CSG. Not every county offers CSG, though, that program, Consumer Support Grant. So it really is individualized. If you get a result back from the assessment and they say you need to try this first, you need to try CSG or any of the other state plan services, you can talk with the county and say, no, I think that I do need a waiver. And maybe that's an instance where you would go back in that min-choices assessment and look at the questions, and maybe some of them are inaccurate. If your perception of your child's needs or your needs, if you're the person applying for the waiver on your own behalf, and maybe there's something lost in translation there. So on this next slide, this has some information that we have already touched on most of. It's just titled waivers. So we've touched on most of this, but if you are looking for one slide to reference that can describe what waivers are, this is it. So waiver programs provide services to meet the needs of people with disabilities and older adults. These programs were developed as a community alternative to institutional settings such as nursing facilities, hospitals, and regional treatment centers. A waiver waives some existing service rules and expands options available for services and supports. So I won't go too much farther into it on this slide, but I wanted to make sure there was a nice slide with the information all in one place there.
Courtney, I have a
So
couple of questions here.
Yes.
And they're kind of painting the last slide, but what is the difference in PCA and supervision of personal cares?
Oh, good question, Jackie. Okay. So this one is a interesting one. So you probably, if you have PCA, you will see different kind of billing where they may even talk about it with you. So there's certain hours of someone that actually works with you. So that's PCA. And then the PCAs have a supervisor who's maybe a nurse or somebody with a higher level of certification that is supervising PCAs, making sure that they're providing services that are the best services for you. So very simple explanation of that. I personally don't know too much more other than that. I am happy to research and get you a more robust answer on that one, though. But that's what I've got for now. I will write that on my list, so maybe in our follow-up I can provide a resource with some more details on that one.
And then I have one more. Can you use min-choice assessment to get medical assistance state plan services?
Yes, so the short answer would be yes. So the min choices assessment should include a number of PCA hours that you would qualify for. So it may say you qualify for 5 hours a day or 10 hours a day of PCA services. At the end of the assessment, it will determine that. So yes, it's the short answer there.
Thank you. I will go on to the next one. There we go.
Right. Oh, the words didn't show up there. Do you want to try clicking again? Maybe it's one of those where it's like delayed. There we go. Okay. Keep clicking until they're all there.
Okay.
This slide is silly, apparently. So this slide just lists all of the waivers on it. It has all the different waiver types. So just a reminder before we dive into these that this is some of that information that may no longer be accurate once Waiver Reimagine is implemented. But since this is a basic training on our current system, I'll give a description of each of these waivers because they're the ones that you, if you have one of these, you know what it's called likely, and these are the ones that are happening right now. So, in no particular order, maybe I put them alphabetical. Um, the first one is the brain injury waiver. So, for this one, you have to be eligible for medical assistance and certified disabled. That's going to be something that is common, but just so that you can have, if BI is the one that you are looking for, you have one slide with all that info. So. Apologies for repetition on those, but so that you can have that quick reference. For this one, you have to be under 65 years old and have an assessed need for nursing facility or neurobehavioral hospital level of care. You have to have a diagnosis of acquired or traumatic brain injury or cognitive or genetic disease with a cognitive impairment, have significant cognitive and behavioral impairment, be able to participate in rehabilitation, and have an assessed need for supports and services above those available through the MA state plan. So all of that is very technical language. None of it's really plain language other than, okay, am I under 65 years old? That would make sense, right? But everything else kind of gets into like, wow, what does that even mean? So that's where the Min Choices assessment comes into play, where it assesses for all of the waivers, and they have wonderful formulas that will tell you which one you qualify for. So you don't necessarily need to know as you're applying which one you're applying for, but this is kind of to give you an idea of, oh, that sounds like it might make sense for me. I have a brain injury, or, well, whatever. So I'm going to go to the next slide because I think that might be what we're wanting. So on the next slide, this lists the services under a brain injury waiver. So I am not going to read off every single one of these. The link will be in the chat, but here's again that slide of your options, and then that link will take you, because this is always kind of changing and being updated, so that link will have the most up-to-date list of services. Okay, so then our next one is CAC, or Community Alternative Care. So for this one, again, medical assistance, being certified disabled, being under 65. This one is a hospital level of care. So you'll notice that level of care is listed. This one is hospital level of care. Your primary physician would need to certify your need for hospital level of care. And then you'd have an assessed need for supports and services above those available through the MA state plan. Again, referencing that. You'll get, that one will get stuck in your brain maybe if I reference it enough times. Okay, and then the next slide again is the list of services available through the CAC. Okay, then there's CADDY. So I'm saying these acronyms as the case managers as the county will say them. So you'll hear CAC, you'll hear CADDY, you'll hear DD, BI. You don't often hear them say CADI waiver. They reference it CADDY. And then, if you don't know what that stands for, you're like, okay, hey, CADDY, is that what they're trying to say? So that's what that acronym means. If you've heard the word CADDY kind of thrown around, that's what it means. Community Access for Disability Inclusion. And you will almost never hear that one spelled out. You will almost always hear it as CADDY. So that is what that one is. Again, MA, certified disabled, under 65. This one is nursing facility level of care. Again, above and beyond MA state plan. And this one, the last bullet is you make an informed choice for services in the community instead of a nursing facility. So again, you're choosing to not be in that hospital setting, the nursing facility setting. You're out in your own home or in your community and getting services there instead of in a nursing facility. And here is that list of services for CADDY. Okay, for the DD waiver, typically you'll hear this developmental disability waiver. Typically you'll hear it references DD waiver. Again, eligible for medical assistance. You need to have a developmental disability for this waiver. So this is one where you do need to have a specific disability in order to qualify for this waiver. Now, not everybody with a developmental disability has a DD waiver, but you do need the DD waiver for that. So what I mean by that is, let's say you have cerebral palsy. That's your diagnosis, and you go through the Min Choices assessment. You would have a developmental disability, but you may also qualify for something like a caddy waiver, depending on your needs. And so then you would pick which of those you would want, which one you think would meet your needs the best. So typically people are only qualifying for one waiver, but there are instances where someone with a developmental disability isn't getting the DD waiver, they're getting a different waiver. So for this one, it's intermediate care facility level of care. You would require daily intervention, they call it, or daily service needs, 24-hour plan of care. Doesn't necessarily mean that you need services 24/7, but there's a plan in place. You will see like a emergency call services where you can call if you need support and there's like an on-call sort of situation. Habilitative service or habilitation service is one that is specific to the DD waiver. And that's, in short, it's more kind of like a learning and growing type of service. So that is one that you need to have in order to keep the DD waiver. And it's very specific to that one. Your case manager, if you are someone who gets a DD waiver, there's a specific list of services that will qualify for it, and you can kind of go through and see which one makes the most sense for you, but that's one that you have to have. And again, even if you have a developmental disability, if your needs can be met by services on those MA state plan, like CSG, you would try those first. The next slide is that list of services for a DD waiver. And again, that link. Okay, the next one is elderly waiver and alternative care. So these ones are for age 65 or older. This would be nursing facility level of care. And elderly waiver is long-term care under medical assistance, and then alternative care is if you're not eligible for medical assistance. So those are the difference there. And the alternative care would be if you had income and assets that are going to pay for no more than 135 days of nursing care facility services. So that's very specific, and that number may change, that specific number, but that's kind of the difference between those two. And then there's the specific services again on the next slide. So I kind of breezed through the difference between those waivers because it isn't necessarily something that you can just pick and say, oh, I want this waiver, I want to apply for it. They'll do the Min Choices assessment, and the one that you qualify for is the one that they will offer you.
You know what?
I do have a couple questions here.
Mhm.
A person cannot have more than one waiver at a time. So
Correct.
can you have more than one waiver at a time?
No, you may qualify for more than one, but you can't have more than one. So when you have that assessment, it may say, oh, you're, kind of in between caddy or DD, you would have to pick which one you would want. And I see a question, and what are the differences between the two? The big difference is that DD waiver, you need a habilitative service with the DD waiver, and the caddy waiver, you don't. I would also ask if your budget would be any different. So if you get that assessment and you qualify for both, I would ask, what's my budget going to be on the caddy waiver? What's my budget going to be on the DD waiver? They may not know the answer, but you should ask. There are certain things that they won't end up knowing until you're actually like in the system and they have to plug in the numbers and all those sorts of things, but it never hurts to ask.
And then like you kind of answered, why might you choose one over the other? You kind of answered that too with that. Perfect.
Yeah, some people, even if the DD waiver, maybe you have more money to spend, but you don't want to do a habilitative service, then that might be a reason to choose the caddy waiver. Okay, so this one is for the CDCS option of the waivers. So this stands for Consumer Directed Community Supports. And a lot of people will say, oh, I have a CDCS waiver. But if you'll notice, this one says it's an option of the waivers. So it's not its own waiver. So you might have a DD waiver and then you're using the CDCS option of it. So when you use CDCS, you choose or design the services and supports that are fitting your assessed needs. You're going to have more control in using funds allocated for your support needs, and you can use both community and traditional services. You can hire people you want, set a wage rate within specific guidelines, like there's still caps, but you can pay a little bit higher, and determine the work schedule for the people that you hire. So this is also an option that allows parents of minors to be paid to support their children. So this option is different than what we call like traditional waiver, like you're using the waiver in the traditional sense, which is the way I described earlier. You're, getting this menu of options. You're picking the ones that are going to meet your support needs that you've qualified for, and those services are implemented. Your case manager is helping with all of that. With the CDCS plan, you're doing more of that building on your own. Your case manager still needs to approve it, but you work with a support planner, and this is typically a lot more creative of a process. You're, thinking about different ways that maybe are out of the box to spend the money. There are still requirements, right? There's still restrictions on how to spend it. You can't just spend it on anything, but it is a lot less restrictive than a traditional waiver. Now, this is not the best option for everybody. Typically there is less money to spend in CDCS than if you had a traditional waiver, although there's been some advocacy on that. So hopefully that won't always be the case. And it is more work, right? You're managing more of this on your own. You're doing more of that creative thinking on your own versus your case manager having more of the responsibility there. So I want to go to the next slide and then I think I saw some questions coming through maybe. So this is a comparison of CDCS versus traditional services. So with CDCS, you set the staff wage within guidelines. Traditional services, the provider sets the wage.
My name is
CDCS, you write the
Courtney
plan.
Kristen. Courtney.
And CDCS, you write the plan. Traditional services, the provider writes the plan. So it's kind of just this comparison of, training staff, hiring staff, developing health and safety plan, all of these things. And at the end, you can see the county still has to approve the plan and the budget no matter what. With the budget and managing it, if you have CDCS, you would have a fiscal support agency that's going to help you with that. So essentially they'll kind of pay out whoever needs to be paid. So it's not like you'll get a big check and then you have to try and pay people. So there is some support there. I did see in the chat that I do traditional and hired my own staff. And this is a possibility, right? It does happen if you have a traditional waiver and hey, I found somebody that I want to hire. Either I did a posting or I just have a neighbor who wants to do this and they got trained in and they got hired. So it's a little bit misleading to say, provider trains the staff or you train the staff or you hire. So to kind of have the difference, it's more in the back end of all of that where I'm assuming, and I don't know your specific situation and every county kind of handles things different, but they probably had to be hired through like maybe an agency so that they could get paid. So that is pretty typical if you have traditional services to kind of have some of your own self-direction with it. This is often called like self-directed services, which you can self-direct really any of your services, but you'll have more freedom for that in CDCS.
Courtney, I have another one. Are the people given the choice to do either traditional or CDCS when they first get approved of the waiver? And then can a person using traditional waiver change into the CDCS and vice versa? So you can switch back and forth.
Yes. Oh, such a great question. So the short answer is kind of yes to all of that, but I'll give some more context. So when you first get a waiver, some counties will say you will need to try out a traditional waiver first. Like, oh, you're brand new to this, you need to try out traditional first because we're gonna have you do that first before we'll let you do CDCS. You should be able to do it right away though. If you know that the services that you want are only going to be paid for by CDCS, like paid parent, and you say that, you should be able to do it right away. If you find, we're going to try traditional, we want to switch to CDCS later on, that can happen. If you try CDCS and you say this isn't working, we want to go to traditional, that can happen as well. The limits to that is they don't want you switching back and forth all the time, especially mid-year. So the counties would prefer around that annual assessment. So each year you'll have an annual renewal, a meeting with your case manager, all of that, and that's when things kind of reset. You'll get your budget for the year. So that's the cleanest time to switch. It's not that you can't do it mid-year, but they may not allow it too many times. So you might get away with like one mid-year, but if you keep changing your mind back and forth, that isn't typically allowed. So each county kind of has a little bit of say in how often they'll let that happen, but a safe bet is when you have your annual renewal is a good time to switch if you want to switch.
And then the last one here is, does CDCS take away the need for the planner? And I'm wondering if you mean traditional, but I'm not sure. Do you? So go ahead.
I can answer that one. So with CDCS, you would need a support planner. Not every county requires it. What I would typically tell people is that your first year or your first several years of doing CDCS, there's a lot of benefit to having that support planner because they've worked with counties, they know what's going to get approved, what's not going to get approved, how to write things, all of that. And if your plan year after year is kind of staying similar, you might not need a support planner. Now, some counties will require it no matter what. I have got to check if there's been any legislation or changes recently that it is required or it's not required, all of that. So some stuff as I'm going through these like rules and regulations, some stuff is just up to the counties and their implementation, and some things are state level where every county is supposed to follow the same rules, and whether or not those are implemented are up to the counties to do it. So anyway, having that planner, yes, for CDCS, you need a support planner. For traditional, your case manager really is going to help you with that plan, but they are not supposed to be writing the CDCS plan because of rules around that. So having that support planner who kind of knows how to quote unquote work the system or work through and write things in a way that they'll be approved is very good. Okay, how do I find a support planner? Who pays for their services? So the support planner will come out of the CDCS budget. So their pay comes out of your CDCS budget. So you don't have to pay them like out of your own pocket, but it would come out of your total amount of the budget. Typically, in percentage wise of how much you have to spend versus how much they'll get for the few hours of developing the plan. Typically, it's a pretty low percentage of your budget, depending on what that total is. How to find this support planner is a good question. So there are typically lists that the county will have, that your case manager or MinChoice's assessor will have, of support planners that they know work in their county. But you can also find them. I can include a link. I believe they're one of the services you can look up on minnesotahelp.info. So if you're someone who's like looking for, you're looking for a PCA, you're looking for, whatever kind of service, minnesotahelp.info is a website where you can go on, and it has all of the providers in the state. It may not have, accurate on whether or not they have openings. It isn't always up to date on that, but it is a really good place to start. And I believe support planners are on that website, but don't quote me on it. We'll double check that one.
I would say to make sure, I would suggest getting one in your county or somebody that is familiar with your county. Unfortunately, what we see just county to county is so different. And there's just no way to get around that. But if somebody is familiar with your county, then I would definitely look for them.
Absolutely. Even the best support planner, if they only know Hennepin County and you're in McLeod County, I wouldn't get that support planner, even though if they're really, really good, because they just don't know how that specific county is going to address things. Okay, I'm just popping that link in the chat. I don't know if it hyperlinked. I might have to find the actual URL. Anyway, though, I know that we've only got a few minutes left here, like 15-ish. So want to get to the next slide. So this is a list of questions that I put together from what folks sent in ahead of time, like in the registration. Now, I won't get to every question that was sent in on the registration, and I see some coming through in the chat as well. Some of that is because if you have a very specific nuanced situation, there were some questions like that were just very specific that we won't be able to dive into today. Other things were maybe not related to waivers closely enough. So this whole system that we're in has many, many layers. And so, we're not diving into medical assistance, Social Security, or state medical review team, all of that sort of stuff, because that's opening too many other cans of worms. So I want to give that caveat. Thank you though for all of the questions. I will try my best to answer as many of them as I can here. And my contact info will be on here as well, so we can get you pointed in the right direction, and there will be some other resources for some of those specific questions, but I will try my best to answer as many as I can. So this one, and some of this will be a little bit of repeat of some information that was said earlier. Some of it will be new. just depending on the question. But how would we know which waiver is the best fit for us? Came up in the chat today. It came up in the registration questions. This is just a big one. And that answer, again, is, MinChoices is going to assess you for all the waivers, and it's going to tell you which one you qualify for. And often people are only going to qualify for one. And that makes your decision very easy. So if you do qualify for more than one, you can, ask the county, what's the budget? You can use the links provided to compare the different available services. You can talk with your county, and I'm going to include Disability Hub and the ARC Help Desk, which are two really good resources that I haven't mentioned yet today, that can help kind of coach through things that, the county can be a really good resource, but you might not always get somebody who has all of the knowledge that you need that can answer all of the questions that you have. And so I highly recommend Disability Hub or the ARC Help Desk, because they don't really have a vested interest like the county does. They're a little bit more unbiased, and they're working with this stuff every day. And they work with multiple counties and maybe know what's trending in other counties. This seems kind of odd, or that sort of thing. So the next one is related to waivers during transition. Now, this one we haven't touched on at all today, but it came up several times in the registration question. So I really wanted to touch on it. So does the type of waiver change once you hit transition age? Like you're turning, 18, you're an adult now, or things changing? So it's likely that the type wouldn't change, but the services within it would. So that's not necessarily the case. Needs can change as we get older, or as our disability evolves and changes and all of that. So you may change waiver type. You may change from a caddy to a DD waiver, or that sort of thing. But most of the time, you're not going to change the type of the waiver. You're going to change the services within it. So, for instance, a 23-year-old who is now out of school or out of their transition school may have had a DD waiver his whole life. You've had DD waiver, but you were in school. Now that you're not in school, you might need more or different services, but you could still have that DD waiver. So, I've been in school, all day. I haven't needed services during my day because I haven't been working. I've been in school. And now all of a sudden I want to look for a job. And so I need some employment supports. And that's very different than the support I was getting through the school district. So that's my short story long, long story short of your waiver might not necessarily change, even though your services would change. Next question. When should we consider appealing the county's decision? Oh, this is such a good one. And again, this one came up a few times. So the very most basic one is if the assessment is wrong. If you get a reassessment, and last year you qualified for a waiver and now it's saying that you don't qualify for a waiver, or you had PCA services and last year you had 10 hours a day and now it's saying you have 2 hours a day. Like those really drastic changes where you're like, wow, something is wrong here. Something's not adding up. Things fluctuate from year to year. But a big change like that, unless you know the reason for it, maybe last year you had your foot in a cast for 6 months and you needed extra support because of that, and you got a higher budget, and this year you don't have that. That would be an explanation for a big change, but there's no explanation for it. That would be a time to appeal. And in certain situations, you could call the assessor and say, hey, something doesn't sound right here. Can you double check it? And sometimes the assessor will go back and look at things. Sometimes they'll say, nope, you gotta appeal. And that's okay. There is an appeal process. Another reason would be if you were getting a service and then you stopped getting it. Like it's just completely like you qualified for PCA, now you don't qualify for PCA at all. Or job code, whatever it is. And then the other one is your support needs aren't being met. If you get this assessment back and maybe it's your first one, and maybe it says you qualify for 2 hours a day of PCA, and you're saying, wow, no, I need, support much more than that. That's not enough hours. That would be a time to appeal and really, trying to figure out the rationale behind, well, why don't I qualify? Maybe you do need support, but they're saying it can be met in different ways or whatever. So those are kind of the big three. Assessment's wrong, you were getting a service and then you stopped getting it, and your support needs aren't being met. Okay, so this next one is what tests are required for a DD waiver? And I had seen another related question in the chat earlier and was kind of saving it for this slide. But I put a link in the chat so you can have that right away, and we'll send out the PowerPoint as well. But this includes information on that. I really am not going to go too far into it because I know not everybody is here to learn about just the DD waiver, but that is your link for reference. It does a really good job of kind of explaining what would maybe be required. What I would say though is I would talk with the county first if you can. It's not always possible to get the right answer, but anytime you're applying for something, you're filling out paperwork, you're doing some sort of testing, you're doing any of these things, it's a long process, right? It's a slog. You're trying to figure out what you're supposed to write. You're spending hours figuring out this paperwork, making sure you're accurate on it, and they have all these warnings on here, like if you lie, this is, bad things are going to happen, and it's very nerve-wracking. And you go through a test, and that can be very nerve-wracking, very stressful for the person going through it, stressful for the people supporting them. And so I hesitate to tell people, oh, just go get this test. Like, it's nice to have it done, right? If you can say to the county, I already have this done, great, I have everything I need, I'm gonna get my approval faster. And that can be really good, that can be a positive. But I don't want people to have to go through things and then find out later, oh, the county didn't need that. Actually, you need this other slightly different assessment. And so you have to do it all over again, or you need this other slightly different paperwork and you have to redo everything. So there's pros and cons to both, right? It can feel really good to have things done ahead of time. And when that works out, it's really nice and things go faster. But especially if you're someone who wants to make sure you're not doing any extra work, even if that means it might take you a little bit longer to get on the waiver, I would really suggest talking with the county first before you go through testing, or you go through just filling out paperwork. So sometimes that testing is something that you just want on your own anyway, and you want to get it done, and that's totally up to you as well, and really up to families to decide what they want to do. So I will stop talking about testing now because we got some more questions. The next one I had already answered. Do I need a consumer support grant before I can get a waiver? And again, the answer is it depends. Sometimes your county is going to say that your needs can be met with consumer support grant instead of a waiver. And you're going to have to try using that before approving a waiver. Sometimes not. So that one's one of those famous, it depends. Okay, this one is a really good one with some new stuff that I haven't really touched on yet. So how do I know what kind of medical assistance or waiver I have? And this is a big one. Sometimes again, you're in that slog of filling stuff out, and you don't know, you want services. Yeah, sure, that sounds good. Am I gonna, get my staff, often there's some unintentional gatekeeping of information where maybe you're not told what kind of thing you have, or maybe you are, but it's not in a plain language way, and it's buried in this paperwork somewhere. So one of the the things people want to know is, well, what kind of MA do I even have? What kind of waiver do I have? Or I want a waiver. Do I have the right type of MA? So you can find this in a few different ways. One is to look at paperwork or award letters that you have received from the county. Sometimes scanning those after you've done a training like this, or after you've kind of looked and you have maybe a newer understanding of the terminology, that can be a good time to look at the paperwork and see if any of the terminology referenced today matches your paperwork, and you can kind of start to understand things a little bit better there. Because often there will be some sort of coding, there will be you know, information at the top or somewhere in identifying information that gives you that answer. The next thing is to call your county financial worker or case manager. So financial worker, I would say for like medical assistance, you'll typically have a financial worker or financial team at the county that's managing your medical assistance, and then a case manager who's managing your waiver. The case manager should be able to look up your waiver type and your medical assistance, and the financial worker will for sure have access to medical assistance. They may or may not have access to what type of waiver you have. If you're in a county like, you know, Hennepin County, they have the front door, and there's some information that they can pull. It is limited because they're, you know, not working directly with you, but they've got their system information there. And then the third way is to call the disability hub. So I referenced this a little bit earlier, but they can do an advanced lookup to find what type of MA or what type of waiver you have. And if your medical assistance closes, they can look up the reason for the closure. They can look up whether you have a spend down and what type of action would need to be taken, if any. Like if you're or your medical assistance closed, what do I need to do to get it renewed? Oh, you didn't fill out this form, or you know, whatever the reason, they can look that up. So really amazing service, especially if you've, you know, now I can't get a hold of my social worker, I can't get a hold of my financial worker, or they didn't know the answer, or I didn't understand the answer. You can contact Disability Hub. All right, I'm going to go through the next few slides just to show you those resources, and then we are almost done. I will take a peek in the chat to see if there's any other questions I can answer quick, but these are some links that'll be sent out. So there's a ton of information on our ARC Minnesota website. We call them ARC guides, and there's just by topic, so on waivers, but also other information. Disability Hub I've mentioned a few times. And then for those of you that really like the nitty gritties, you like comparing, you like seeing all the services and linking, the community-based service manual is what the counties use. It's what your case manager is looking at. When I was a case manager, I was in here every day. When I was, you know, answering help desk calls, I was in here every day looking at, well, what does the rule say? Has there been an update? What is this specific service? How does it relate to that one? So if that's something that you want, look at this. I will say it's very intense, not written in plain language, but if you want to look at it from the source and be looking at the same thing that the county's looking at, you can even like send them the link of, oh, I looked this up in the CBSM. Does this apply to me? It looks like this is the rule, you know, that sort of thing can be really helpful when talking with your case managers. Next slide. This is the Disability Hub information. There's a few specific links on here. I wanted to include them. So they have a really cool My Vault feature where you can like store documents. And they have a benefits planning estimator as well, which is a cool feature. So definitely click on those. And then the next one is our help desk, which has some links. We have a form you can fill out, or you can call to talk with somebody on the help desk. And I think that was maybe the last slide, or, oh, there's just our contact information.